Hi, everyone. We're just waiting for our final panelist to join here in another minute or two. She's having a couple of technical difficulties, so we'll get started here in just a minute. Thank you for your patience. Dr. Najaba, we're just going to wait another minute or two. We're just waiting for our final panelist to join. She's having a couple of technical issues. So once she's here, we'll go ahead and get started. Thank you for your patience.
Cameroon is playing today for the Nations Cup, so it's kind of an interesting. It's a soccer game going on.
Okay, while we're waiting for our second panelist to show up, why don't we go ahead and get started, Audrey? And we'll go ahead and have our first panelist present, and then once our second panelist shows up, we'll actually start the panel.
Sounds good. Okay, let's get started. Okay. Hello, everyone, and thanks for joining our panel on climate change. My name is Audrey, and I will be keeping time and moderating questions along with my colleague, who you may recognize as the co-director of the actual conference, Zachary.
Hi, everyone. Thanks for being here today.
So as a reminder of our theme, the goal of our panel is to focus on the following. The rising average global temperature has been widely indicated by scientists and advocates as posing substantial risk to health that will be impossible to reverse. Furthermore, the consequences of climate change disproportionately affect under-resourced countries and communities who contribute least to the problem, but have the most limited ability to mitigate the resulting harm and are the most frequently displaced. There is a growing need for solutions to mitigate climate change that actively counteract race, gender, and class inequities. So our schedule is roughly as follows. We have 10 minutes per speaker, and we will be starting alphabetically with Dr. Kevin Najabo. Then we will hear from Dr. Bhavna Shamasunder, after which we will have a 20-minute Q&A session with moderated questions that Zachary and I have prepared. Then we will read out questions from the chat from the audience. So if you have any questions for the speaker, we ask that you send it in the chat or send it directly to myself or Zachary, and we will ask the question to the speaker after our 20-minute moderated Q&A. So as a gentle reminder to our audience, we request that you keep your microphones off in respect for our speakers during their presentations. And to our speakers, I will be sending out a reminder at the 8-minute mark through chat. So shall we get started, Zachary?
Let's do it.
Okay, so it is my greatest honor to introduce our first amazing speaker, Dr. Kevin Najabo. Dr. Kevin Najabo is the UCLA Pritzker Education Fellow and Associate Director, Africa Director for the UCLA Center for Tropical Research and the Congo Basin Institute. He holds a joint faculty position at both the UCLA Institute of the Environmental and Sustainability, as well as the School of Public Health. He is part of the senior leadership team, primarily responsible for overseeing the center's research portfolio, and the ongoing delivery and development of the Congo Basin Institute serving Central Africa. His broad areas of expertise include educational research, environmental health, ecology, ornithology, global collaborations, and evolution of emerging tropical diseases. Dr. Njabo also serves as a visiting professor to the National University of Rwanda and to the Higher Institute of Environmental Sciences in Yaoundé, Cameroon. He is also a fellow of the African Scientific Institute. Welcome to Dr. Njabo.
Thank you very much. The background music from the conference, can you get it, or am I just the one getting it?
Pardon?
You have
background music.
You have to close that tab on your computer because I was getting it too.
I have to close that tab?
Yeah, where the little microphone is, because when you register, it gives you that music. But you're in the Zoom room, so I just closed it and it went away.
Okay, that's fine. I just did. So makes sense now. So can you get me now?
I'll say we can hear you just fine.
So cool. So I think I'll need to share my screen so we can. Okay.
We can see your screen just fine. So if you want to click from beginning, I think that'll start your presentation, Dr.
Okay,
Njabo.
I can do that. Okay. So let me set up my slideshow, just make sure everything is set. Okay. So welcome to everyone, and thank you very much for giving me this opportunity to talk about it. I'm just making a simple presentation today. I just want to look at the impact of climate change and look at that, how you can link it to global health, because I know that is the theme of the talk today. So the first thing I was talking about, really, what is climate change and how is that really important? So as an opening slide, we just want to say, we look at ourselves, and I always try to look inwards. When we talk about climate change, we look at the defining issues of our time, and we are at that defining moment. So I just want us to put that in our background, that is, it is about us. It's about the only planet we have on Earth. So if we look at from the shifting weather patterns that will threaten the food production systems in the world, if you look at the rising sea levels that would increase the risk of catastrophic flooding, the impacts of climate change are just global in scope. And so they keep on going, and it's something that we really need to address. So I got this slide from the website of the United Nations Environment Program, because if you look at it, it tells us the factors that are actually responsible for the increasing zoonotic diseases, diseases that are transmitted from animals to humans. So when we go back to the COP26 is the Conference of Parties of the United Nations that was held in Glasgow in the UK in October last year. So the UK government tried to work with every different government around the world to reach an agreement on how to tackle climate change. And under the Paris Agreement, which all the different countries, they came together to commit to bring forward what we call the national plans to set how much they would reduce emissions. And so that is what we call NDCs, or nationally determined contributions. So as part of that Glasgow conference, or as part of the Paris Agreement, all the countries, they said, okay, let us come back in every 5 years to bring up an updated plan on how that will reflect their highest possible contributions at the time. So prior to Glasgow, what was very interesting is nearly every country in the world actually missed the deadline for how to strengthen the plans to fight climate change under the Paris Agreement. So, and that is really scary. So what we're looking at was saying that we need, as people, as scientists and as global citizens, to take on board the different environmental signals that we see, what they mean to our future, and what they mean to our well-being. So COVID-19, as we now see, is by no means a silver lining for the environment. So it is something that we really need to address. And when we talk about the One Health approach, we need to look at the way in which people are closely connected to the environment. People are closely connected to the health systems, and we all share the same environment. So if we take care of the environment, then we take care of the planet. So when I try to look at it, I bring out just three different things, three things that we need to address. So when we talk about the climate, the first, a healthy planet means fewer diseases. So there is just a real opportunity to meet that demand for green packages of renewable energy investments. We're talking about smart buildings. So if you've been to the IUES, the Institute of Environmental Sustainability and campus of UCLA, that is an example of a green building. We need to go green in our public transportation systems. And with respect to diseases itself, the challenge is understanding where those diseases come from, because the health of our planet really plays that important role in the spread of zoonotic diseases. So as we continue to encroach into fragile ecosystems, we bring the humans into ever closer contact with wildlife. And when we look at illegal wildlife trading, we look at illegal wet markets, those areas are not really infrequent causes of such diseases. So around 75% of new and infectious diseases are zoonotic in nature. So, and today, about 1 billion cases of illnesses, or more than 1 million deaths, occur every year due to such diseases. So if we can take care of that, so the first thing is a healthy planet means fewer diseases. Second action that we need to take, the wild must be kept wild. So as we expand into territorial ecosystems, it means that our activities are altering the natural phenomena. So today, more than 75% of the Earth's surface is squeezing the wildlife and nature into ever smaller corners of the planet. And so we have to understand that nature, as we see it, is critical to our own survival, because nature provides the oxygen, it regulates our weather patterns, it pollinates our crops, produces the food, feed, and fiber. And because of that, as we encroach, it is under severe pressure. So any changes that we see in temperature across the world, when we see this humidity and seasonality changes, all those will directly affect survival of microbes in the environment. And evidence suggests that the diseases, epidemics will become more frequent as the climate continues to change. So it is something that we really need to take care of and how to tackle it. Lastly, the key point which I want us to talk about when I said three things, the last is we need to build a different economy. We need to be looking at how do we move forward? Where do we go from here post-COVID-19? So the better we manage our nature, the better we manage human health. So this is why when we talk about the post-COP26 biodiversity framework that countries need to develop at the end of the Glasgow conference, it is really, really important on the issues that come out of there. We need to think about how to address it. One of the most important pillars in this, in the post-COVID recovery plans, we must plan how to arrive at a very ambitious, measurable, and inclusive framework, because keeping the nature or the environment rich and diverse and flourishing is part and parcel of the support system of the world. And even what is more important to consider is when you look at 25% or to 50% of pharmaceutical products that we have today, they are derived from genetic resources, and the thing comes from our environment. So as we open up the world, if you see what the UK government just did, You see, we are playing the Nations Cup in Africa. So we're now moving into a different phase. The engines of growth are beginning to rev up again. So we need to see how prudence to manage nature, and we need to be that part of the different economy that is obliged to emerge. There is no way we can run away from that. So one where our finance and the different actions and things that we do around the world, we need to look at how those actions will fuel green jobs, green growth, and a different way of life, because the health of everyone, the health of you, the health of me, and the health of the planet are one and the same, and both can thrive in equal measure. So those are the things that we need to look at. So those are the three things when we talk about implications of climate change and health. We need to make sure the planet stays healthy, because once they're healthy, we have fewer diseases. We need to keep the wild, and we need to build a different economy. So those are the three things, and those are the things that I would just want us to talk about as we move forward post-COVID-19. Because if we encroach into the environment, if we keep putting so much pressure, then we're going to actually disrupt the natural ecosystems, bring in more diseases. And because of that, climate is going to go up. Looking at our emissions, we look in our carbon, and we can look at how we look at the greenhouse gases and measure the amount as they accumulate across the earth and across the years to see the direct correlations with climate change. So those are the three things I want to talk about today, and I will just open up for questions. Thank you very much.
Thank you, Dr. Njabo. So we're actually going to hold questions till after both presenters speak. So in the audience, if there's any questions that you would like to ask Dr. Njabo, please feel free to type into the chat, and we will direct those questions to Dr. Njabo after the second presentation.
So thank you so much, Dr. Njabo. That was an amazing presentation. I look forward to the panel. Next, for our next panel speaker, I want to introduce Dr. Bhavna Shamasunder. She is the Associate Professor and Chair of Urban and Environmental Policy and Chair of Public Health at Occidental College. She holds a master's from Yale University and PhD from Berkeley. She teaches and conducts research at the intersection of environmental health and justice with a focus on inequalities and chemical exposures faced by low-income communities and communities of color who live and work in urban and or industrial environments. Thank you again for joining us today.
So thank you for having me today. I know how much work it is to organize a conference, so I appreciate all the work that went into struggling to get us faculty here. We have like these busy teaching and research schedules. So, and I always really like to meet, I'm glad to meet you, Dr. Njabo, since I never get to travel the distance between Oxy and UCLA. So I'm going to share my screen, and you can let me know if you can see it. Does that work? Can you see my?
Yes, we can see it.
So I'm going to go to slideshow. So I'm going to just introduce my own work, and you'll give me a prompt if I go too long, since 10 minutes is short. Can you hear me? Okay.
Yes. Yeah, we can hear you great.
All right. So my work is really in. I'm going to take the opposite approach of Dr. Njabo and start with the really local communities that I work in. I'm an environmental justice researcher. I work in partnership with communities to do my work. And I want to talk about really the links between what happens with a global climate transition, global climate change, and what happens on the ground for communities. So I operate, environmental justice has been around for a long time, but really there are multiple definitions of environmental justice and environmental racism. And there's a sort of government definition, which is the first one. The principles of environmental justice is called for fairness, regardless of race, color, national origin, or income. And really equity and thinking about where people live, work, play, and learn. But I really am thinking a lot about the histories of environmental racism that structure our communities, and the fact that we have come to be very comfortable with creating sacrifice zones where we put everything which no one else wants into some communities, and we have an economic justification for a lot of those logics. And the people who live in these communities often become invisible, unseen, unknown. And my work is really in partnership with communities that are in some of these sacrifice zones. So community engaged research, you can take a class on this, there's big books written on it. But there are some real frameworks that I use in my work, which are thinking about how do you actually manage to involve communities who are most impacted. And this is true of climate change, right? So climate impacts are uneven across the world. They're very local. And LA, for example, is going to get hotter with climate impacts. Places that are already hot and lacking access to infrastructure, water access, shade, those are going to be some of the most vulnerable communities. So, and these are already communities that are impacted by things like worsened air pollution. So we're thinking about different scales and scope of engagement. So I work with communities just from framing the research question all the way to how do we actually report back data? How do we write papers together? How do we publish in multiple formats? And these really try to consider uneven power, privilege, time, and resources. And overall, we're interested in shifting the scientific and regulatory enterprise, that we work with the operating thesis that engaged communities make science better. It actually improves the rigor, the reach, the relevance of science. We think about differences in expertise and the clarity about the possibilities for change and action. And we work for transparency and communication and a joint understanding of what it means to do research and how we can actually move an agenda on the ground. And this is because time scales in the research can be really long and emergencies on the ground can be very short. And there are different scales at which people feel pressure to do their work. So my projects are numerous. I'm not going to talk about them in great detail given the time, but I work on multiple projects that are in partnership with communities. So the Taking Stock Study, which you can learn about takingstockstudy.org. I work on SCLA Push, which is an air pollution project in South Central LA. Taking Stock is a beauty product and consumer product study. And I work on oil drilling in Los Angeles. So LA is one of the largest urban oil fields in the country and the second most oil-rich basin in the world. So that's a picture on the left is a oil field in South LA, the Jefferson oil field. And if you followed the news this last week, LA City Council voted to make oil drilling a non-conforming land use. And this is a huge victory for organizing that's taken a decade, and research that's been in partnership with communities that have been at the fence line of these fields. So community-based research works. It's important, and it does, it can move an agenda on the ground. So that's how I think about my work. So my research site is largely South Los Angeles. So LA has a population of 10 million people. The county, the city is 4 million people, and South LA is, as you can see on the map, a portion of Los Angeles. So all of my research, which I think about as really local, has very global implications. So South LA, if you look at it on a map, this is CalEnviroscreen, which is a tool, the operating tool that the state of California has adopted to understand where the worst impacts of environmental pollution and social and economic burden merge. And so you can map all of California. You can go to OEHA, Office of Environmental Health and Hazard Assessment, and look at the maps across California. But South LA looks like this, with the 90% being in the red, and you can see other parts of the map are green. But this means that South LA is in the highest, most burdened communities in the state of California. So it has both social and economic burden, high poverty rates, low educational attainment, also high burdens of environmental pollution. So all of it is sitting in this little area. And we think about what does it mean to unravel these pollution sources. And so the LA story on oil drilling, which is a long one, and I've written a lot about this, so I can point you to some of the articles, can't go into it very much, but LA is, you know, if we think about climate as being driven by fossil fuel extraction, 100 years of extraction have been in Los Angeles. And so we have operated with the idea that it's okay to put houses and schools next to these active oil drill sites. And we have prioritized what we've prioritized is land value. So as property values went up, we sold them for houses. As oil values went up, we sold it for a drill site. And so you get this very unpleasant land use pattern where you can drill right next to a house. And this is indeed, we drill right next to houses. So this is a boy walking in front of the Allenco drill site. You wouldn't know it was a drill site because it's camouflaged. And this is a Jefferson oil field on the right where there's a house right next to the drill site. You can climb into the second story window and look into the field. And when they're drilling, the arm of the drill goes up. You don't see it all the time. And there's workers with hazmat suits in the working, but the kid living next door clearly doesn't have a hazmat suit. And then finally, we spent a lot of money camouflaging oil in LA. So the top left-hand corner is Thumbs Island. So if you go to Long Beach, you can go see this. And it's basically an oil field that was designed by a Disney architect to make it look pretty. So at night, it looks pretty. That's what it looks like. And it actually stands for Texaco, Humble, Union, Mobile, and Shell, which are the oil operators that drill behind that Disney facade. So follow the LA story, but it's 10 years of struggle where communities organized to get oil out of the city. It's not gone, but they have voted to make it a non-conforming land use. So the other big project I work on, and I'll tell you how these are related, are how do consumer products actually fit into what this landscape is. So there are place-based burdens, but we think less about consumer product burdens. And so I'm really interested in this particular question. Can you buy in South LA that might be different than what you can buy elsewhere? This is a national problem. We do not regulate our consumer products. We don't test them before we market them, not like a pharmaceutical where it's tested and then marketed. So we have 80,000 chemicals in commerce that are unregulated. The implications of this are pretty enormous in that we see these ending up in our bodies. So chemicals in consumer products are increasingly linked to endocrine disruption and other things like cancer, fibroids, preterm birth, diabetes, and other diseases. And we see a really big disparate impact. So if you measure, NHANES is the Center for Disease Control that measures 212 chemicals in people in the US population. We know what's in our bodies, and we see a disparity. While these chemicals are in everyone, they're really in Black communities and brown communities at higher levels than they are with other people. The question is why? We can measure downstream and see the chemicals, and we also see these health impacts, but we don't know why. And we hypothesize that there are two things happening. One is that there is this environmental injustice of beauty and product use. And we wrote this paper in 2017, Zota and Shamasunder, you can look it up. And we hypothesize that there are actually drivers of product use that are really upstream: colorism, textural preferences for straighter hair and lighter skin, and cultural norms about odor. So things like odor discrimination leads to the use of things like talc powder. And if you've been following the Johnson & Johnson case, there's been a really huge upsurge in gynecologic cancers and lots of lawsuits on the fact that asbestos was found in baby powder, right? But you see this far more in Black women, and we see this linked with a lot of odor discrimination, which is not very much talked about. More talked about is these hair texture preferences. Preferences for straighter hair really do have material impacts, and so does preferences for lighter skin. Has material impacts. People lighten their skin and straighten their hair because they get better jobs, better partners, and because there are we live in a racist society, right? So Zachary, you'll give me a flag when I have only 2 minutes.
I was about to say we're a little bit over at this point, so if you could finish up the next 30 seconds to a minute, that'd be wonderful.
30 seconds. Yeah. Okay.
Thank
so
you.
I will say that my work is really connected from these two on these two projects, in that a lot of the base of all of these chemicals are actually coming out of oil. So oil production is linked with a lot of product manufacturing, including beauty products. So at the core of what's driving climate change, we also see is our economy is built on a fossil fuel infrastructure. And so the base products of coming out of a barrel of oil are really the both we see on the community side as a place-based exposure, and we see it as a consumer product exposure also. So the long line between health and the environment is challenging, connecting the dots to climate, because these are multifactorial, they're hidden, they're slow, they're delayed in time, they're delayed in distance. And so it makes it very hard for us to contend with some of these impacts that are driving climate change because of how extended some of the impacts are to measure. So sorry, I went over, I am done. I will turn it over. Let me stop sharing my screen.
Thank you so much, Dr. Sommerslender. I think this is where we're going to go ahead and start our panel if Audrey's all set to do so.
So first of all, thank you both to our amazing speakers for your inspiring messages and the reminders of the importance of climate change and the different ways that the environment plays a role in human health. So now we just have a few questions directed at both speakers. So if either of you would like to answer the question, you can go ahead. And we are certainly welcome to hear from both speakers. So let me just pull up, okay. So my first question is basically related to how COVID-19 impacts your work. So I know that Dr. Njabo has stressed the importance of managing the economy for greener jobs and maintaining biodiversity, while Dr. Sommerslender has highlighted the importance of community-based work. So my question is, how has COVID-19 basically played a role in how, if it's more difficult for you to do your work in this field?
So should I go first, or do you want Dr. Barbara to go first?
No, go ahead.
Okay, like I said, I always use that quote because we have from the United Nations Environment Program, when that quote came out, that by no means COVID-19 should be the silver lining for the environment, because they're looking at, but we need to understand the environmental signals, the signals that come out of the environment, and how we can move forward with what we do and how we continue doing our work. Yes, COVID-19 has given us a new reality, but if you go back in time, you're going to see that as an ecologist or people working in the environment or epidemiologists, it shouldn't be any surprise. Pandemics are things that we expect. So all our models have predicted this. If you go back 2010, 2011, we predicted these pandemics are going to come out. So we need to modify how we deal and how we interact with the environment. It can be business as usual, but again, we always need to get that reality check. That's how we are. I think the norm in the world is we are more reactive than proactive. So we tend to want to respond when it hits us, instead of when we see those signals and we tend to ignore them because it means absolutely nothing. Then the other thing I would like to stress on is, how do we translate most of the science to policy? Because we realize the huge political impact on what policymakers do and how to move the world. And if scientists cannot communicate better or try to make sure the signals or the models or the science that we see, how do you translate that into policy and make sure policymakers understand the process and communicate that to the population? Then there's a huge disconnect. Then we have this tendency of keep talking to ourselves. And when we talk to ourselves, that we can't move forward. So we need to be able to transcend or to break that space. And usually I would say that depending on how we look at it, without being I'm not trying to look down on any group of people, but if you can say, how do you make sure you can convince a Trump supporter in what you do, then it means you're breaking those bounds. And how do you communicate with people who you think don't understand your same language? It's a very thin line to draw, but it's something that is the reality. And if we don't address it, it's really going to affect us continuously.
Thank you. Does Dr. Sharman?
Yeah, I guess I'll just add, I totally agree. I think that we as scientists need to be better about talking about our work in clear and thoughtful terms so people don't think we're preaching at them and telling them what to do. But I think, I think COVID has really done two things, which I think there's that book called Nothing Shows Inequality Like a Natural Disaster. I think that's true of this pandemic, right? It's revealed kind of the vast inequalities in our society in a way that has always existed. It's not that those things are not there, but we can see them in kind of relief. And it's also made it really hard to reach people who are most vulnerable because we don't have good infrastructure to do that. We haven't done a good job on distributing vaccines. We haven't done a good job on making sure that equity is prioritized. And I think that, the government has funded vaccine development, and really vaccine delivery should be global and equitable if we want it to be something that actually curbs the pandemic. And these are public dollars and they're treated as private dollars. And I think that is a real challenge to our system. So I'll stop there.
Thank you so much to the both of you. So the second question that we have is that we understand that addressing climate change is very difficult on an individual scale because it might feel very daunting and it feels that it's something that requires massive structural changes. So how would you think that we can make an impact on an individual or local scale in terms of environmental activism or getting involved in local environmental justice movements?
Yeah, I think I'll start by thinking of, we have to understand that we have one Earth. That's the only Earth we have. And there is no other planet in the universe that is close to the Earth. And so we can explore as we want, we can go to different places, but if we don't take care of what we have and we destroy it, it's not going to come back. So that is what we need to make sure that we understand. Then secondly, there are resources that we take out of the environment. The things that we take, some of them are renewable, some of them are non-renewable resources. So if you take out, you're going to deplete it. So we need to look at the Earth as something that we borrowed from our children than something that we inherited from our parents. So if you borrow something from your child, you want to make sure when you give it back, it's in a better shape. And don't think that I just inherit, and we can't live as if the world has some infinite resources that we can keep tapping from them. It's just going to deplete and going to be destroyed completely. Then we think of the different ways in which, how do you preserve our own environment? How do you make sure your neighborhood is clean? There are just simple things that we try to do ourselves. It impacts us how we live our daily lives. And so breaking it down in those simple terms to make sure that personal hygiene, personal cleanliness, our clean environment, use of energy, reducing of fossil fuels, there are just simple things that we can translate into how much you can do. Then when we go to looking at the bigger picture, we have one of the best environmental policies is the Dutch Green Plan, where it says the polluter pays. So the Dutch Green Plan is so nice. Like the two biggest polluters in the world are the US and China. They need to pay for the destruction of the environment. We need to make sure we hold them to that responsibility. So make sure we can offset. We need to make sure we reduce our carbon footprints. That way the message is going to go across.
I agree. I think that the communities where Dr. Njaba works in, the Congo Basin, people who live in outside of the US use far fewer resources, period. There's an environmental footprint project where you can measure your footprint. I suggest you do it. It's a good exercise. But it's actually, as soon as you live in the United States, your footprint is huge. And it's really not because of any individual choices that you can make to reduce those footprint. It's not that you should go and like use all plastic and trash things. You know, there are of course individual choices that we make to reduce our consumption, to buy things that are recyclable, etc. But the biggest thing we can do is actually work to change policies, work for renewable energy, work for cleaner food systems, work for water delivery, work for fewer food miles, right? There's lots of ways that we can try to think about how the US is actually directed towards hogging global resources. And so shifting that is really a policy question. It's an individual question in some ways, and then a big policy question. So get involved with your government.
All right. Thank you so much for your advice on how we can basically lead our daily lives, and as well as to basically advocate for policy that can make a bigger change. So now we have one final question from me and Zachary is, what is some advice that you would like to share with students who are interested in pursuing a career that focuses on the intersection of climate change and global health?
Yeah, the first thing is understanding the One Health approach. It's a nice thing that we have to look at that interrelationship between us and the environment. We need to understand that we share the planet with other species. So if we know that, then it helps a lot. Then come back on campus. There are simple things that reduce wastage. It's when you go to to the cafeteria, you just see the amount of waste, the amount of things that we are just so entitled in the way that we just throw it away. We don't know how much we're wasting. So there are simple things that we can do, and it just, I don't know how to put it, but somehow just awareness, reawakening, just think of the different things, look at the different parts of the world, look at the things that we do. Are we really doing it right in the US? That is we need to think. And when you start getting into public health and into global health and travel into different countries, you look at the case when the keynote speaker was talking about Rwanda today. Those are the realities in different parts of the world. How do we compare to that? How do we meet those standards? Are we just living in the country because we are just entitled to everything, and so much entitlement is pushing us overboard? And so we need to just step down, come down from that pedestal and see, how do we make sure we make the world a better place? How do we make sure we just help in one way or the other by starting from ourselves, but looking inwards?
No, I think that on a very personal level, I think embracing a little bit of discomfort is a good, we live in a society where there's a lot of convenience. You can buy a bag and throw it away. You can buy a zillion products and use part of it. You can throw away your food. And, kind of really being thoughtful about how you do and don't do that is one kind of small step. If it's a little inconvenient, it's okay. That's okay. If it's a little less plastic. So that's like a small kind of action. On a big action, I think that there's a lot of medical students in this conference, and medical school really does a lot of work that we undo in some of our efforts, is that it really hones down to individual bodies and who can pay for care and who we can treat, and and who may be left out of that, and who shows up at the hospital, right? So this is, I think doctors and physicians can work really against that and think about their work in interdisciplinary ways and partner with public health practitioners, urban planners, and others. Things like Physicians for Social Responsibility LA provide platforms for that. There's Tracy Woodruff's shop at UCSF. She does a lot of work on educating physicians on environmental health. That there are other ways that you can use, and doctors have a lot of leverage in the society. So using your degree and your credentials behind your name to really kind of move upstream from the individual patient level is, I think, a really good way to think about getting involved once you finish school and while you're in school.
Thank you. I definitely agree that the growing trend of interdisciplinary work in climate change is more and more important, especially for medical students and the audience too, that understanding that our role as practitioners in the future definitely has a big impact on the health of the people we serve. And it's always a great idea to have health equity in the back of our minds. So with that, thank you for those answers. Now we're going to move on to some of the audience questions. So from the audience, the first one is for Dr. Najabo. How would GMOs be considered a sustainable long-term solution for declining food sources if climate change does not become any better?
Genetically modified organisms, like for everything, it's a two-edged sword. So there is always the good side and the bad side. But let us not try to, as much as possible, to always amplify the negative aspects of GMOs. GMOs also have, they also have pesticides. There is always a go between. So if we need to look at how does the science help us? What is it that we can take out of it? So what are so if we look at the positive aspects and amplify, then there's a lot to get out of it. But let us not have that tendency of always trying to beat up every new innovation that is coming out and think it is negative or it is destructive for the environment. There are just so many nice aspects of it which we need to look at. And as scientists and as budding scientists coming out, it's on us to determine how do we want to make sure we use it in such a way that it adds value to our health, it adds value to the environment, and it takes less. So when you talk about the One Health approach, we're looking at managing the amount of space that we have instead of trying to encroach continuously into natural habitats. When I put in 3 points, I said a healthy planet means fewer diseases. Then I said wild must be kept wild. They have their natural space. We can't just keep encroaching into it. So, but how do you manage our own space in such a way that it is sustainable? By sustainable, I mean satisfy our needs, but not compromising future generations from also satisfying their own needs. That's what we call sustainable. So how do you manage that space in a way? So that's why you talked about the green economy, green jobs. Then how do you pick out those good aspects of it? Those are the things that we need to know. Tease out the bad from the good and amplify the good.
Thank you, Dr. Najabo. So I hope that answers the question for our audience member who asked that question. And the second question is that in both of your expert opinions, how should the healthcare system be involved in environmental health?
I've thought a little bit about this, and I think that, the healthcare system really does prioritize treatment and medicine. And I think it would be great if you could buy a health insurance plan that gives you like a gym membership, or, access to preventative care more than it does now. And it's a really hard system. It's very embedded in profits, and it's embedded in really government being able to lobby government officials. Doctors should get involved in shifting in the medical insurance system. I think that would be, and think a little bit about organizing. I don't think that, physicians don't organize as often as other groups. And I think an organized physician base to lobby for changes to health insurance might be of an effective strategy to include more prevention.
Thank you. And just another follow-up question for Dr. Shaman Sunder. When it comes to the product-based exposure inherent in the beauty industry, what actions can consumers like myself take beyond becoming more conscious of consumption and raising awareness?
Yeah, it's really hard to do because there's very little transparency in the beauty industry. Like, things are not labeled. There's ingredients that are not listed that are there. Using fewer products is a good start. Avoiding phthalates, parabens, and phenols if it says phthalate free, phenol free, and fighting for chemical policy reform is a big one, to have more transparency in our ingredients and banning bad things in our products, and using fewer fragrances. fragrances are protected by trade secrets. We don't know what's in them. Often there's things that we don't want in our bodies in them. So avoiding fragrance chemicals.
Thank you. And okay, so now another question is that we mentioned earlier about how communication is important in the role of environmental health, and how policy is also very important. So another question is there a way that we can make larger structures, such as countries, accountable for any climate pledges that they make, such as, for the example of tobacco control? There was a lot of legislation that allowed basically countries to be more accountable. Is there a similar way that we can do that for environmental health, in your opinions?
Yeah, I think there are so many things that when we talk about science, and that's why you see when we talk about when you look about moving forward and what we are looking at, when we say we need to recognize that the health of people is closely connected to the health of animals and our shared environments, which means close contact with animals and their environments will provide opportunities for diseases to pass between humans and animals. So if we have that mindset, then there are so many different ways in which we can develop nice policies that interact between for environmental health. So once we know that it is a shared environment and we all have a different part to play. So what is it that we need to make sure to keep it together as one piece? It's like one body with so many different parts, that every different part has a very important function, and we need to work together to make it to make the world functioning. So those are the things that we need to look at. But the tendency, like I said earlier, we always have the tendency to be reactive instead of proactive. So how do we make sure that we can develop policies and programs that will help us work together? Even on campus at UCLA, how many programs do you have between the North Campus and South Campus? So we don't really see a lot. It looks like completely separate environments where different professors and faculty work in silos. We need to find a way in which we can be developing programs that have the North and South Campus working together and developing combined projects in such a way that to address a single problem, we need the help of anthropologists and sociologists and epidemiologists and medical doctors and scientists and ecologists working together to come out with that solution. That is the One Health approach. And I think moving forward, we can develop policies that will be able to address all the environmental issues, including environmental health and sciences.
Thank you. And Dr. Shamasinder, do you have anything to add to that? Or
I think that tobacco is an interesting example because the tobacco industry, once it was sort of curbed in the US, it really found new strategies and audiences and populations in the global South. And so I think we've given corporations for new landscapes of addiction, right? So we've given corporations a lot of power. We prioritize a global economy and have created health as an externality. And if people get sick, that is not accounted in kind of how we measure economic well-being. And I think that is a fundamental framework. It's capitalism that we operate under, and unless we actually shift how we think about corporate power and the kind of power governments give corporations, because the corporations really do move one country to the next. So when Johnson & Johnson, stopped selling talc in the US, they didn't stop in other countries, right? So I think that there needs to be a strategy, a joint government strategy for that kind of work, which is hard. It's hard to build the political will for that, but it's important. It's possible.
thank you. And
Next, we have another question, and I'm gonna try to ask this in the best way possible because it's a long question, and I want to get to the root of it. But the question comes from one of our international partners, and they're talking about the fact that research coming out of their institution on climate change from, quote unquote, global South institutes is often not voiced or even potentially censored by things like social media or the news. And they were hoping that maybe you could discuss the fact how this impacts Americans' perceptions on climate change and how that's related to their health, and how such a small percentage of Americans have this almost disconnected connection between the two. I don't know is that a clear enough question for both of y'all?
Yeah, you could. And I think if you look at one of your awards that you gave out, you talk about publications in oncology, and you're looking about peer reviews, papers from people, researchers from the Global South, and how you have this unequal rate of publications. Then there are lots. We also came out with a paper looking at challenges of the diaspora scientists communicating research, and how do you connect with people from the Global South. There are a lot of issues where we try to address that inequality and how you see what is it. The biggest example you can talk about the Amazon. When we had the fire in the Amazon, the United Nations, I think they came together, they wanted to give some money to the Brazilian government. It was about $20 million. So the government rejected it. But you can see what happened in Paris when you had the cathedral, the Notre Dame, when it went on fire. It easily raised $1 billion to help a building. So you can see that disconnect. It is so, but if we look at the amount of how do we live in the US, about more than 32% of the oxygen we breathe in the US comes from the Amazon. So if you take out the Amazon, you're destroying a huge part of the earth. That's the lungs of the earth. It is that science that we need to translate. And when you go back to the Congo Basin, we talk about the Congo Basin sinks. We're just looking at how much carbon is found within that area. So how do you communicate that? Yes, there are different ways in which we have to look at it. Not really on social media. It's not the best platform to send messages out and to peer review research. If you're trying to make sure you want to give out information, and you use the social media platform as your forum for communication, people start doubting it, because anybody can post anything there. So we need to make sure we look at a system where we can filter what is good and what is bad. We can look at what is qualitative information and how that information can be peer reviewed or authenticated. So we have to look at the different platforms. So are we looking at open access journals where people need to pay for them, and where people from the Global South cannot afford to pay for those? Or we try to look at a way in which most of these journal systems can accept publications or research from the Global South, so that it is communicated thoroughly in fora where everybody can accept and relate to those type of results. So it's a challenge which we have to address. It's something that we need to look at, and more in different fields, people are coming out with different ways in which we can try to address that issue. So it is not one cup that fits all. It's somehow that we are going to work in bit by bit and breaking it down in such a way that eventually we're going to come out with a solution that can bring out that communication stream between researchers from Global North and Global South.
That's a super hard question. I think that Dr. Njabo is really thinking about, it's important to communicate. It's really hard to do, but I think the, the COP26 that happened in Scotland, the climate conference, there was, very little commitment from the United States and other developed nations. And I actually think that some of the solutions in the Global South are to decenter the voice of the US. I think the US has an outsized voice in publishing. I mean, I think it's really hard to do, but organizing collectively and decentering kind of the lack of commitments is, I think there were some activists who really, indigenous activists, Global South activists, really called out the United States and the lack of a commitment. And I think more of that and calling out the kind of contradictions of doing all this research but not centering the voices of other scholars around the world is really, I think, a problem. And the academy prioritizes individual voices, you get tenure and promotion for tooting your own horn, right? So I think that there are like a lot of things that lead to that, but I don't think it's an easy solution, but I think organizing, I have a lot of faith in organizing.
Definitely. So thank you both to our amazing speakers for the engaging conversation we were able to have today. Your messages in stressing the importance of communication and the role that we can play on both an individual and local scale, as well as the need for us to press the policymakers of our nations to make commitments to climate change, especially in the United States. This is so important and relevant to our goals today. We actually have a few more questions that we were unable to get to today from the audience members. So we were wondering if there is a method of contact, an email that we can share with our audience members if they have more questions for you.
Of course, they can email me.
Of course, you have our email. So I know both Zach and Audrey, we've been communicating by email, so you can share that.
Yeah, that's fine with me too.
And then you can also check our websites. You can see most of the things that we do and the research that has been done. I think UCLA has nice websites that we publish the results, and our projects are all posted there. So you can also share that link so people can take a look and see what we've been doing.
Sounds good. We'll make sure to update our website so it has your contact information as well, so that people have additional questions, they can go ahead and follow up. Thank you again for your time. I'm sorry that I have more questions as well. I just wanted to let everyone know we're going to take a quick 5-minute break, and then you remember the main screen that we have back on the website. We're going to have our second keynote starting promptly at 10:40. So 4 to 5 minute break, grab some water, some coffee, and thank you again to both of our panelists.
Thank you both for organizing and your whole team.
Thank you very much. So,
Have a great rest of your morning, all. See you in a little while.
You.
And please join us for our networking hour from 12 to 1. We're going to have some fantastic. Okay.
Yeah.
Take care, y'all.
take care. Bye-bye.
Bye.